Right, welcome everyone to the March 25th speaker series hosted by Reverend Allie Benjamin. She's the Vice President for ANTN. And today her special guest is Michael Benjamin, her husband, who is a chaplain in the hospice arena. And so we turn it over to you, Reverend Allie.
Thank you. Well, hello everyone. Welcome to our speaker series. It's always a delight to meet here once a month. And today we have a very special guest, Michael Benjamin, my husband. So as I was thinking about who to include for this month's speaker series, Michael came up because he's been such a shining light for me in my life as I've experienced loss of loved ones. I've witnessed him and his open heart as he has supported so many in their time of end days and transitioning. So I introduce my beloved husband, Michael, and so here he is.
Good morning, everybody.
We are in the desert in southern Utah, and so that's the beautiful scenery you're seeing behind him. So Michael, you're a hospice chaplain, and you're also a practitioner of religious science of mind. Yep. How did those two work together, and what led you to take your ministry into chaplaincy, particularly hospice chaplaincy?
Well, thank you, and good morning, everybody. It's good to be with you. So how do they come together? You know, it materialized for me sort of as a synchronistic event, but the answer is they come together really well. As I was interviewing with the position, and I'll get to how that interview developed in just a second, but as I was interviewing with the position, the doctor who owned the hospice company it was a private hospice, and the doctor that owned the hospice company asked me plain and simply, I just want to know one thing. Does your training, does your tradition, does your spiritual belief system allow you the opportunity to be with people neutrally? i.e., can you accept all people, regardless of their faith or their religiosity and so forth? And I know that this group here knows the answer to that, because I was like, well, yeah, because that's my training. That's not only my belief, but that's my understanding of the light of spirit. And because he digressed and said that he hasn't had a very good experience in the past with other clergy, although he might align with their spiritual views and their religious preferences and so forth. He said that the feedback that he received from the families wasn't favorable, i.e. telling people that they need to go a particular direction as they're leaving this world wasn't standing well for the family. So he answered the call to say, I want to find somebody that can do spiritual care but remain neutral. And my experience was, as a religious science practitioner, my training, my philosophy, my findings of oneness of the light, and being able to see that with all facets of life worked really, really well. And how was I able to find it? Well, actually, I was in the process of caring for my mother, who was leaving this world. And some of you knew my mom and others may not, but she was also a practitioner of 30 years at the Bear Valley Center for Spiritual Enrichment up in Big Bear Lake in Southern California. And we had a very open, loving dialogue for years about her diagnoses with lung cancer and her eventual transition. And as her life got closer and closer to the end, I moved to be with her, and in so doing became her spiritual care provider. And we meditated together and prayed together and worked together every day and talked about what she was feeling and what she was experiencing. And eventually, when she started to get visitors come in, I was able to, be open and receptive to that. And so it was in the process with Mom that I heard the voice say, you should become a a chaplain, spiritual care in hospice. And in that, I always pay attention to invitations. And so I picked up the telephone, I Googled hospice in the area, and I Googled, and up came this particular hospice company. For confidentiality reasons, I'm going to not use names today. And I called them, I left a message, and the very next day, I got a call back from them and said, "You are an answer to our prayers, because we have been looking for a chaplain for a year, and we want to meet with you right away." And so I went down and met with him, and right on the spot, he made me an offer. And wow, I had no idea that it was, what was going to come from that. And so it was a beautiful experience, onboarding.
Wonderful.
Yeah.
So from what I know, your practitioner credential and your practitioner license was what let you qualify for the position, correct?
Yeah, it was up at the Utah Center that we serve at as well. We have one of our practitioners there is also a chaplain, and she's the one that brought it to my attention that when you're a credentialed as a chaplain, that's the same as like a licensed unity teacher, or the same as a deacon at the Catholic Church and so forth. And maybe not all states, I'm not sure, I can't speak categorically across the board, but certainly in the state of Utah and California, when you have your practitioner credential and your license at the center, you do have the right to do funerals, as we all know, but also in those states, that allows for you to become a chaplain.
Beautiful. So can you share with us some of the practices that have been particularly supportive of your clients, patients, and their families? What did you find after being with your patient and their families? What did you find supported them the most?
Yeah, several. I think probably because what we experience, I've come to realize what we experience is really a reflection of consciousness of where I'm at. What the things that, and we'll get into it in a little bit, the things that I heard, the conversations that I had, the experiences that I had as a continuation of, I believe have to do everything to do with me. So primarily the most important practice was the evocation and the preparation I did leading into my visit, i.e. the opening, the awareness, the setting the intention. And so for me, one of the big ones was listening to music. I always listen to the Karen Drucker music on the way in. Daniel Nahmod has several songs that work really well too. But the Karen Drucker song that says, "I will stand by you, I will stand by you, I will stand." And that song for me really evokes the unconditionality of my love and willingness to sit with people. Because let's face it, when we're transitioning and we're at the end of life, what that physically looks like can be for many very difficult to sit with and to dive in with. Not for me. For me, as I open up my heart, as I really tune into that desire to connect to the spiritual, I find a willingness to sit with people in their in what they would probably label as their weakest state, that failing human state. Sometimes strokes, all kinds of issues come up when the body's failing. But to be with people in that place of absolute unconditionality, that ability to stand by you and sit with you and know your truth. So that for me was the lead in, I think, and the key to the success. But the tools that I learned in my practitioner training, in my many years of training, stem outside even the religious science tradition. But we know religious science is open at the top. So that's where Ali, you as my teacher, that's where you introduced the mindful based stress reduction concept in the ability to help people to escape if you will, pain by stepping into using the conscious mind to step into the light, to move beyond the physicality, to step into the light, into the spirit, and have that experience. My observation was there wasn't any condition that we would be experiencing, and many of them come with a great deal of physical pain, that we couldn't experience relax and peace. And so meditation, music, guided imagery, and all of which I would put in the category of a mindful-based stress reduction. And so those were all things that were extremely effective, helping patients to find relax in what could otherwise be very difficult to relax. And this crosses, oh, go ahead.
No, go ahead, you go.
It crosses over, as a chaplain. By the way, I like to use a different term. I think that's unanimously accepted, but for me, it's spiritual care. And that also not only is something I would offer to the patient, but to all of their loved ones, their children, their grandchildren, their friends, their caregivers. And so it stems to be much more than just with the patient. In fact, many times I would meet with family members away from, when they were getting respite or when they were at their house, is when I would go sit with them there and help them, with their fear or their struggles.
Mm. You now, how did your spiritual care go over with people that were, say, of a different tradition, different religion? Were you accepted by people from other walks of life and other religions?
Not always, but that is a choice that they have, as to whether or not. But my role also as the spiritual care coordinator with our patients might be that if they had, let's say, if they were a member of the LDS Church and they wanted to have their bishop come, I would coordinate that visit, and I would communicate with their bishop, and I would also chart that for the Medicare, purposes. And so absolutely wide open. If they had a preference for their particular clergy, then I would make that reach out and coordinate that. But I would say 90% of the time, they choose to have me as a visit. And a big part of that was because within that first hour, as I was doing the intake, if you will, the interview upon intake, I think they plain and simply felt my love. And regardless of their tradition, their children, their loved ones, the patient themselves asked me to stay and be the provider, if you will, that would stay with them during that process. So
I know,
but to answer, I need to answer this because I know you asked it and I didn't answer it. In my training, in my years of training, I learned to not only understand and find the truth of the religions, the big ones, obviously, the Catholic tradition, the Christian tradition, and the Mormons and Buddhist and Hindus and so forth. And so I believe that I've learned to pray and align with those traditions as well. And so as a chaplain, first and foremost, you're not really forcing religiosity down somebody's, throat. And so I've learned to become that, and also, remain in my, in my truth with my ability to speak first position, directly connected.
beautiful. I'm sure that people are really listening to your words, and things are starting to spark in their minds, as I know all of us are. As we age, we are experiencing the loss of family members and the loss of friends and colleagues. And so it's something to think about. It's something to plan for, I guess. I know you made reference to caring for your mother, and I know that your father is currently in hospital, close to the end. I'd love it if you could share a little bit about some of the mystical experiences that you've had, maybe briefly starting with your earliest mystical experience that you can remember, so people get a real sense of why you would put your hand up for being a hospice chaplain. So what got you knowing there was something more?
Yeah, I'm almost a little reserved against answering that to begin with, because I don't believe that the things that I've experienced are necessarily prefaced with my early year experience. I think anybody can have the communications take place, but I will answer that because you asked. I was hoping that you would maybe ask that in the Q&A at the end, but I did have an NDE when I was 3 years old. And that was a drowning experience. As a youngster, I fell in the pool at a party. My parents were partiers and multi-family party. And I fell in the pool, and nobody knew how long I was there unattended. And one of the other youngsters, 3 or 4 years older than me, finally said, "How come Michael's at the bottom of the pool?" And then they jumped in and saved me and brought me out and did the whole pump your chest thing and so forth. But it wasn't until this journey into grief a couple months ago that I actually had a direct remembrance of that moment when I was about to cross over, or when I was actually crossing over at the bottom of the pool, when I was met by a wall of water, an angel that showed up in the water and stopped me and said, "Michael, it's not your time. Turn back." And from that experience, over the next couple of years, my mother had several opportunities. She was awake and open, and where she was able to interview me, where I was directly talking to angels and God. And I was saying things and delivering information to my mother and her friends that 3 and 5 year olds just simply don't talk about. And I also remember those times when she was evoking my entrancement. And I remember sort of stepping out of the way and allowing that information to come forth. So, but that was my experiences, and I'm just starting to dive into what that really means. I don't believe the experiences that I have had with my patients communicating to me and their guides communicating to me I don't think that was a requirement to have that. You see, when my son passed 2.5 years ago, 3 years ago almost, and going through it with Mom, I sort of looked at the phase of transitioning as being where I was. And then I heard the answer, I heard the request say, you consider being a chaplain, consider getting into spiritual care. And of course I did that. And so it was in that process where I started to hear the other departments within the within the hospice, the other disciplines make reference to patients that were hallucinating. And I heard strong and fast, hallucinating might not be validating the reality of the communicating that's going on. And so I was really enthused to go sit with patients that were known to be hallucinating. And as I was sitting with those patients in meditation, in the quiet moments, some of the patients were known to have Alzheimer's or be in advanced stages of dementia. And they may or may not even be really communicative to me. But yet at the same time, their children have asked me to be there, and they have asked in many ways through their children for me to be there. And so I remember sitting with a particular patient that was having a continuous ongoing conversation with what turned out to be her brother, who transitioned 10 years before. And in starting to find out more and more about this particular patient, they had been separated through adoption for 60 some odd years. And they were only together later in life for a year or two before he had a sudden heart attack or sudden departure from this world. And then she cared for her husband for a number of years and he transitioned. And then here she is now in her 90s. And she is having a real-time ongoing communication with her brother. And it was after several visits that I really began to explore the idea that there was real communication going on, that this wasn't just hallucination. And this is when I asked her, is John, I'm making up names now, but is John here with you? And she looked at me very clearly and locked eyes. First time in a dozen visits that she locked in with me. And she said, oh yeah, he's here. And I said, can John speak to my son? And within about a minute's time, she looked at me again. Her eyes changed, her tone changed, and I had no doubt that John had entered. And he said to me very clearly, Adam, Adam, Adam is in the light with me. And this being, something that they do not know me. They do not know my family. They don't know my history. And so we began what has been an ongoing series of conversations with my son and other patients that cross over. And so it's been amazing. It's been amazing.
Wow, I know that I'm tearing up myself just remembering that story, because Adam being the name of our son, it was very shocking to hear that. And I remember you racing home to tell me that experience, tell me of that experience. How have there been other experiences that you have had with your patients that have helped their family come to terms with the transitioning, with their loved ones transitioning? Have there been other situations that have brought comfort as you've worked with families?
Yes. So many. I'm thinking about one particular experience that I had that was very brief. Many of our patients actually are with us for a year or even two. And so there's a long developing relationship and that happens. But I'm specifically remembering this one situation. I walk in and the cabin is about 300 square feet, the size of a normal bedroom. And the bed, it is in the center of this one room place. Very, very tight. I'm sensing as I walk in, everybody is uncomfortable and the patient is in tremendous stress about where she sits now. She does not want to go. Very tearful, extremely tearful. And it turns out that the family was not, they have had a long history with drug and alcohol experience and abuse across the three of them. I'm here with the daughter, the son, and the mother. And the mother's also an addict. And so they are having there's this sort of energy of discombobulated sort of, but here we all are. And I remember her saying within a minute or two of listening to my voice she relaxed and she closed her eyes and she said, "I really like the sound of your voice." And we finished the interview, we finished the intake, so to speak, and they had decided that they wanted me to provide spiritual care through the process. And I was getting ready to leave town for a week because I serve at a couple different spiritual centers. And I said to them, "Well, I'm getting ready to leave for a week. I'll be in Utah for the next week or so, but I have one more day. Would you like me to come back tomorrow?" And the patient said, "Absolutely. I want you tomorrow before you go, and as soon as you come back." And the family also agreed. And then I met with the family outside, and the son explained to me that they don't really believe. They don't have much spiritual belief, and they don't know what to believe. They've never had a philosophy. They never had spiritual involvement whatsoever. So he was very frank and said, "I don't really know where we go, but I'm glad that you're here, and I'm glad that she was receptive because she never has been before. And so we'll see you tomorrow." And so I came in tomorrow, and when I showed up, he met me in my car in the driveway, and he said, "Something's going on. I don't know what happened, but she's made a huge move." And my words, move. He said, "Something's terrible is going on. I don't know what's going on with mom." But and so I walked in, and I could see immediately that there was that she was. He said she was expecting you, and so I walked in the room, and we began to have like what turned out to be like about a 3-hour experience where she left in my arms at that moment. And it was the most, well, I can't say the most, but it was tremendously rewarding for everybody, where I was, observing that everybody was like standing back at the edge of the room with their hands back, and nobody really knew how to be. And so I dove right in bed with her, and I was holding her, and I was loving on her, and I was telling her how loved she was and so forth. And I noticed that the family started to get closer and closer and closer to me. And eventually they had their hands on me as I was doing what I was doing. And so I was moved at some point to sort of step off to the side and replace them with me, and then I put myself around them. And so then, before you know it, we were just all just right with her, up close and personal, and we were having this amazing spiritual experience. Textbook, like they say that there's signs in my training within hospice. They talk about the signs that lead from month to days, days to weeks, and down into hours to minutes. And all of these signs started to present. So I knew that she was actively transitioning. And I knew that I wasn't going to leave until that process was over. And so when it was all said and done, I was able to explain to the children the spiritual evolution that was occurring, so that they could observe this process happening. And the answer to the question is, I still am in communication with them, with the children, and they have told me that moment, that experience changed their life forever. They have beyond doubt the spiritual awareness that life continues, and that we're spiritual beings having a human evolution. And so so that's one of them. I could keep going, but I know our time is fairly limited here.
Thank you, Michael. It's beautiful. Before I open things up for questions, I'd love everyone, if you've got questions for Michael, or if you'd just like to share a personal experience, we're going to have an opportunity to do that. So what would you like us to know about passing over? You mentioned that nobody ever dies alone. Is there something you'd like to share with us before we open it up for questions?
Yes. So we know, and I know I'm speaking to a group of advanced practitioners, and we know that we're light beings having a spiritual experience, which is having a human incarnation and evolution. The depth of the divine and the depth of the light, the depth of the eternal and infinite really is infinite. And from the human perspective, it's very difficult to understand the totality of what that means. But our experience in working with every one of us has guides, guardians, mentors, angels that are very close to you, ascended loved ones that have an expanded view that are available to you. And it's a win-win. It's not like the lucky stick. It's not like for the select few. You see, the divine wholeness, the sovereign wholeness of the divine experience is enriched more fully as our ascended loved ones have the ability and the opportunity to work with you to build consciousness, to build a higher vibrational experience here on the earth plane. So it's really part of the divine unfoldment and the win-win aspect of it. So fear not that you're taking from their experience of holding them back. I've heard that often, like, you've got to let them go so they can have that experience. No, that's not what I'm hearing. What I'm hearing is we are enriched by the opportunity to help you from our expanded view, to communicate. We also know that the prayer and the answer are one. And so that if the prayer is that I want to be able to communicate to my guides or to my ascended loved ones who have expanded view, then the answer is get quiet and hone in the ability to be able to hear it. Because the real question I have to ask would ask is, do you have the ears to hear? Because I have no doubt that they are communicating and it is real.
Thank you. So I'd like to open the opportunity up for anyone to ask Michael a question or to just share an experience or maybe comments about what you've heard Michael talk about. Is this your first experience hearing from a hospice chaplain? Has hospice been something you've experienced? And so, yeah, is there anyone?
Go ahead, Marco, unmute yourself. There you go. And anyone else that wants to ask a question, just unmute yourself and ask at the appropriate time.
Thank you.
Well, hi, everybody. Michael, thank you for sharing that. It was profound. And I actually didn't even realize what the topic was going to be for today. And I have experienced hospice in the last few weeks. And I've experienced the passing of my brother 2 months ago and my mother a month ago, 2 days before my birthday. And all I can say is that hospice was it was different than what I had thought it was going to be. I ended up really being able to communicate with my mother on a spirit level. And although I felt that her earth suit, her body, was leaving, I felt her consciousness alive. And it was amazing, the one way, but really a two-way, because it was an intuitive dialogue I was able to have with her, and closure and wonderful words. But what I really wanted to share is a mystical experience that I encountered just 3 days afterwards. So of course, I think by divine order and just how things lined up, I saw the departing of my mom, having been raised as an only child, a mama's boy, so to speak, as the most impossible thing to fathom, outside of, the passing of one of my children. And in the last 6 years of this intensive, not study, but confirmation of these philosophies, of what I already knew, really birthed a tremendous amount of awareness for me. And unbeknownst to me, my uncle of 93 years old was a closet metaphysician. And he gave me a call the day after Mom made her transition. And he asked me, at what time did she pass? And I gave him the time. I said it was at 9:40 on Saturday. And he started saying, okay, well, what I would like you to do is on Tuesday, which would be 3 days afterwards, find a quiet place and just meditate however you'd like. You can say a Catholic rosary, you can do a mala, you can do whatever you'd like, but just radiate the love, the immense love that you have for your mom. I said, okay. And up to then, I was feeling very weepy and grieving and doing this all alone. So I said, what the heck, what do I have to lose? Let me try it. And I did, and I started preparing. I saged a little bit, burnt some incense, put a candle and a picture of my mom. The last time I remember, last Mother's Day that we shared, just smiling at me, very loving. And something amazing happened. I saw in my imagination, I saw an image of her, and it was with a very mischievous smile, but a sweet smile, a peaceful smile. And I recognized the mischief. I recognized the woman that I remembered her long before she lost herself into dementia or in her consciousness. I remember her salsa dancing with a vacuum cleaner on Saturday morning, shaking her butt. I remembered her off-color jokes. I remembered all of these things that made her special to me. But now there was a tremendous clarity, a peace that was just tangible. And the first instinct that I had in that moment is, Mom, help me feel that. Help me feel that. And I did. Yeah. And I have not shed a tear since. Not since.
Bless you.
Yeah, bless you.
Marco. Thank you for sharing that. And I'm so sorry for your losses. Yeah, thank you.
Thanks for sharing.
Who else would like to share or ask Michael a question?
Well, one
Jan,
thing. Well,
Jan,
oh,
there's
sorry.
Jan. Jan, if you want to unmute yourself.
I just did, thank you. I was deeply moved by your presentation, Michael. I was a hospice volunteer until last year of 15 years, and had some beautiful experiences, not quite like yours. What I did experience, and I'm really curious, and I do not intend this to be in any way negative, within the hospice organization, is there any question on the part of the other people about your spiritual beliefs? I'll explain why I'm asking that question, because my experience was, as a minister and a volunteer, there were staff chaplains of other denominations. And I was asked to submit some paperwork from a New Thought perspective of being with the patient and what New Thought, stood for. And they never included that in all of the other denominations. There was definitely a schism between the traditional, and a unity was sort of fringy, and religious science didn't belong. And I'm curious if you've experienced any of that.
That's a very, very, very good question. And I would say that the opportunity was there for that. But I think I come so strong in my consciousness that it didn't materialize. I.e. almost, I would say 90% of the staff were of one particular, fundamentalist tradition. And they completely accepted that I was the spiritual care coordinator. And they had so much positive feedback from family about the love and the acceptance and how comfortable everybody was, that they were just blown away by that. Because in the past, they actually had the other kind of feedback. They had that guy's never coming back here again. Don't send him back out here. You know, they actually had that. And actually, they were teetering on getting in trouble with Medicare because, you know, Medicare pays for hospice care. And so the way that it works, I mean, you have to be compliant. Well, as a chaplaincy provider, as a hospice provider, you have to remain compliant with Medicare's rules and regulations. And one of them is that you need to provide spiritual care. And so if your chaplains are being fired from the patients all the time and you're not being compliant that way, then, you know, the doctor can get some pressure from Medicare as well. So it worked out pretty well for me, but I see what you're saying, and I know that could very well happen. So.
Well, I did not, it in no way affected my performance. I was just observing from my perspective that the dominant thing, but the staff were totally accepting. The volunteer manager and all of there was no problem for me. It was just an observation that I was a minority and I was not going to be one of the, I was very active in a lot of different ways, but it was just one of those things I observed.
In reflecting, there was, you know, I've always been sort of labeled as a chameleon a little bit, to be able to adapt to and become like those around me. And so I did notice that when the nurses were around, or when the RN or the doctor was around, and if we were going to do, you know, prayer for over a patient, you know, I would speak a language that was very consistent with their, you know, their position. So.
Yep. Thank you.
But the power of it's in him that we live and move and have our being. It's in the light that we live and move and have our being, in the Christ light. The power of that works for me as well to evoke a treatment. So.
Yes, absolutely. I totally get it. Totally get it. Yeah, we did vigil work also for quite a while. So yes.
Alison, was there anything, I mean, while other people are thinking, I don't know how much time there is left. How much time is there?
We have about 14 minutes, and
Okay.
Reverend Abigail has something to ask.
Or share. I don't know, Steve, are you willing to share about your mom and dad? You got to unmute yourself, hon.
I knew that.
Yeah. Yeah, I have, well, had a couple of different experiences. Had a lot, but I mean, this is having to do with his parents. But I remember, Michael, when you were saying that a lot of times the people will be, they consider it hallucinations, and they're really talking to people from the other side. And I remember Steve was saying his brother was telling him that his mom would look up and start counting all the brothers and sisters that, you know, were there, and he was there, and he's there, and, you know, and so, you know, we truly believe that actually happens. That's not.
Well, the interesting part, to make it real quick, my mother was looking at a family album, and my father, who had passed, was one of 5 brothers. One was still alive. All the rest had gone. And my mother's looking into the photograph album, seeing a picture of the 5 brothers standing together. And she points to the picture and she goes, 1, 2, 3, 4. Not 5. 1, 2, 3, 4. And then she looks up and she goes, 1, 2, 3, 4. Then she goes into crying, upset, and then she continues on with the pictures. At that moment, I knew, my brother and I knew that my father and 3 of his brothers who had passed were standing there. The spirit was there. My mother saw it, was part of it. She counted it. And I just know that that continues on.
And I actually felt when Steve's dad passed, Steve, I had to fly back from Pennsylvania and Steve stayed there. But one morning I woke up, I think it was Thursday, and it was very, very early, like 4 or 5, something like that. And I just had this panic attack almost, but I knew there was somebody in the house and I couldn't move. I was just frozen. I couldn't move. And my hands were kind of clasped. My head was down on the pillow. And I knew people were in the room. I knew there were 2 people. And I was consciously aware of one of them saying, she knows you're here. And she is aware. And all of a sudden I truly felt hands cupping my hands and kind of a feeling of thank you. We love you. I know I just wanted to come visit you. And then it was over and I couldn't wait to, once I felt that the 2 presences had left, I couldn't hardly wait to call Steve and tell him I really think his dad just paid me a visit, but I was frozen. I couldn't move, but that was it was a physical experience as well as a conscious experience.
Yeah. Allie, I had one other thought that I wanted to add where you had asked if I had any other experiences with family, with my patients after they crossed over. And the one that I had many of them, and I'm always amazed how, as we were leading up to the event of the transition, if you will, inevitably we would start to talk about, and I would always tell them, when you transition, when you go into the spirit, if you're not too busy, if you have the ability to come connect with me, I want you to know my heart will be open. And I would love for that. I would love to have, a relationship with you long-term in that regard. So I'm visiting with my regular talker patient, and I'm with her every week. And this other patient that I was with had made her transition, and some 8 or 9 days had gone by since she made her transition. And she said to me, I would love to connect with you. And if I can, I will. And so here I'm sitting with my patient who's regularly talking. And when we opened up our session, I heard her say, oh, who's that? Somebody else joined you today. Who's she? And she said, who's Joanne? And I said, oh, okay. Hi, Joanne. And I said, and so I said, Joanne, what, tell me anything that you can tell me. And she said, tell Isaac to get on with it. So I was like, whoa. She said, tell Isaac to get on with it. So I called the daughter and I said, who's Isaac? Backstory, it was a multi-million-dollar estate and there was all kinds of turbulence around mom's money. And that was open dialogue right up till the moment of transition. And I said to the daughter, I said, who's Isaac? Is there an Isaac in your world? She said, yeah, Isaac's mom's stockbroker. I said, well, your mom had a message for Isaac to get on with it.
That's funny.
Yeah.
Okay, so we've got time for one more short question or comment. Someone, I know that there's one of you that wants to say something, And just know that whatever you share is really enriching to all of us. And so if you're feeling that little angel tugging at knocking on your chair, then please let us know what Spirit wants to share with us today through you.
Okay, Reverend Kent has had his hand up for a bit. Can you
Okay.
unmute? Can you unmute yourself? There you go.
Absolutely. Thank you. My apologies. I had an appointment, and so I got in a little bit late, so I didn't get all of your talk, Michael. My background, I'm an RN. I've been an ICU nurse for about 30 years, and I also worked in emergency department. And people like you have been so pivotal in allowing people to and their families to come together and make that transition. And my own mother was real clear when she wanted to make her transition. She wanted to be home with hospice, and it was like birthing into a new dimension. My sister, myself, and then my mother's sister were all there. And it was the most miraculous thing I've ever experienced in my life. And thank you for the service that you provide, because without it, I don't know what people would do. And without hospice, I don't know what people would do.
Thank you.
Thank you.
Thank you, Ken. All right. Well, it's that time. It's time to wrap things up. So,
how do you raise your hand on this?
Hi, Dr. Janine. You just
Okay,
did.
Janine, we've got a minute left. Go ahead. Go
I
for it.
just thought your stories were so heartwarming. I was listening on my phone and really appreciate your sharing. And I feel really uplifted and inspired having listened to you today. Thanks so much.
Oh, thank you.
Thank you,
Can't
Dr.
wait.
Janine.
We can't wait till we can all be together in October. I just know it's going to happen this year, so buy your tickets.
Yes.
All right. I'd love it if Michael, would you do a closing treatment for us? And is it possible to include some of your guides, guardians, and angels within our closing prayer?
Yeah, they're always with me. So let's just take this time together and just open up our hearts and become aware of how thankful we are to have enriching experiences that are provided and made in part possible not only by our consciousness but by the affiliated New Thought Network and the coming together of all these different states and different backgrounds and different people and so it's with joy in my heart and enthusiasm in my heart that I say thank you for being here today and participating, and thank you for being open and open to your connection to your ascended loved ones and your guides and guardians and mentors and how you put that to practice in your life to some people call it intuitive, but to be intuitive in your counseling sessions and your communications with your communities and your congregations and so forth. And I know that today served not only myself and everybody here, but those that will listen to it in their own time in the days and weeks and months and years to come. And so thank you very much for joining us. Thank you for participating in this collective consciousness. And we look forward to seeing you at the Affiliated New Thought Network Conference in Missouri in October.
Yay.
Thank you. And so it is.
Yeah. And so it is. And I hand it back to you, John. Thanks, everyone.
Okie doke. I don't have any announcements at this time, so we are free to conclude. Thank you so much, Michael. Oh, let me ask, Reverend Allie, who is next month?
Next month, we have Reverend Kathy Young from CSL, and she's going to be talking to us about what's next, what's up for New Thought, and how we can expand our ministries with all of the new the new realities due to COVID-19 and beyond. So join us at the end of March for Reverend Kathy Young. Thanks, John.
All righty. Thank you, everybody. Thanks for attending. I love this. Thank you, Reverend Ali, for creating this and hosting this. We're so grateful.
Thank you. Bye-bye, everyone. Peace and
Bye-bye.
blessings.
Goodbye. Peace and blessings.
You too.
Thank you, Michael.